Thank you so much. I'd like to start by acknowledging that we're meeting today on Noongar lands and paying my respects to elders past and present. I'm also really pleased to be here today and would like to thank Gary Kanishka and the Academy for having me. So my presentation is entitled Tackling Vaccine Hesitancy and Refusal in a Polarising World. And I have the benefit of standing on the shoulders of giants and building on some of the contributions you've already heard from the other speakers today. But I was asked to define the central conflict in my area of research as I see it. And it was really interesting to go away and really think about pinning that down to some high-level key points. And I found three, and it's a process. And it's actually deceptively simple. Number one, some people refuse vaccines. Some people are hesitant and think about refusing vaccines but may not actually do it. This has been something I've been studying for childhood vaccines since 2013, but of course we all know it became a very big deal during the pandemic. So, issue number one, people refusing childhood or COVID vaccines. Issue number two, the state comes along and says, no, I don't think we can tolerate that. The state cannot tolerate vaccine refusal, of course, because our vaccination status affects each other. So if other people around us are not vaccinated, disease can spread in our communities. So in many contexts, along comes the state and says, okay, we're going to impose a vaccine mandate. We're going to impose consequences on people who don't vaccinate as a way of making people vaccinate. And as a public policy measure, it can work, it can be effective. But those same people who started the issue of not wanting to vaccinate will then very much resist the idea of having a mandate imposed on them. And in certain circumstances, that can lead to political polarisation, where that issue of vaccine refusal becomes connected to other valued and salient attributes of people, especially perhaps how they vote, but maybe also other things to do with their lifestyles. And if vaccine refusal gets attached to those things, it becomes amplified through those communities, through those affiliations, and then we are all in enormous trouble. So, how can we potentially tackle this issue? Not that easily, which is why the people in this room are so important. This is going to be a really significant area for years to come. But it's not hopeless, and there is so much that social science has already done in this space. I'm so proud to be part of the field that I'm part of. I think we have already unearthed some really, really important insights that have been able to be translated to policy and practice. But there is also plenty more awaiting us. So one of the first things we actually need to do is simply to understand. And that's what we do as social scientists. We seek to understand. And that includes the attributes and beliefs of people who are either hesitant, worried about vaccines, or perhaps refusing them altogether. You know, who are these people? Where do they live? Are they male? Are they female? Are they young? Are they old? Are they rich? Are they poor? Are they culturally and linguistically diverse or First Nations? You know, what is going on for these people and what do they think and feel? And we can uncover that through doing qualitative research, which gives us depth, which helps us to understand phenomena that we don't understand very well. We have deep conversations, a little bit like the ethnography that Loretta talked about. We go in deep, we understand the complexity. And then we can also measure prevalence through quantitative studies. We can understand how many of these attitudes are out there, but also what kind of things attach to each other. So that's how we would get across things like age or gender. But also we can do some really interesting things with qualitative methodologies, not just for understanding people's attitudes towards vaccination, but also towards people's understanding of policies and people's thoughts and feelings of policies. So Jeff, in his speech, talked about the use of community juries. We've actually done that in Australia on the East Coast. We've just finished a paper about it where we did community juries with the public and gave them a lot of evidence around the consequences of vaccine refusal and asked them to decide what policy settings that they thought were appropriate for dealing with parents who don't vaccinate their children. Another thing that we can look at for overcoming the challenge of vaccine hesitancy and refusal is by working out what kind of communication strategies are helpful. And this is where I think my field has been the strongest. So we've learned that there are certain types of trusted messengers that should be the ones giving vaccination advice and recommendations. For example, we've learnt that healthcare professionals are often that person in someone's life. So developing a raft of strategies for those people to intervene, to have conversations, to test those strategies, to evaluate what works. Why might it not work? Why didn't it work in that situation? So that's something that we can do around trusted messengers, but also the content of the messaging and how that messaging might affect someone's behaviour and beliefs. But the pointy end of things for me is the challenge of how to limit political polarisation around vaccines and vaccine policy. And this is really difficult. In 2013, a political scientist called Dan Kahan in the United States did a really interesting piece of work where he looked at whether vaccination was politically polarised in the United States at that time. And everyone thought it was. And it was kind of the thing that at a dinner party people would be saying, oh, you know, vaccination's getting polarised. But it wasn't. And at that time he said, you know, all these other things are, you know, attitudes to abortions, attitudes towards gun ownership, beliefs in climate change. That stuff was all polarised. Beliefs in vaccination were not yet polarised. And he said, be so careful. Be so careful that you don't even talk about vaccination as being a polarising or polarised issue, because even in doing so you could make it such. And really try and keep it away from all of those other things that you think it's travelling with. And ultimately, you know, that didn't happen. I think I've done a talk before that sort of mentioned the idea of Kahan's tears. Like, I don't know if he's actually cried about it or not, but he should, because ultimately that polarisation has gone on to occur, largely in part because people have sought to impose vaccine mandates, which, you know, I think in certain contexts can be very, very reasonable policies. But imposing them in the United States, in that population, I think has ultimately backfired and will lead to a decrease in vaccination coverage, such that with my co-author Mark Navin, we've just had a book come out called America's New Vaccine Wars, California and the Politics of Mandates. And we actually argue that, you know, we trace the policies, we trace the pro-vaccine parent activists who change the policies to make it more difficult to refuse vaccines. And these are my people, like these are people I connect with and believe in, but I worry that in the context that they've done that, and the alliance they formed with the Democrats, which then leaves the refusers to go and ally with the Republicans, that we're actually going to see the return of diseases like polio and measles into communities. And Mark and I are arguing now for a mitigation strategy, which we've taken from obviously the climate issue, and basically saying we might not be able to stop the spread of infectious diseases in American states, particularly in red states. And so what does it look like instead to adapt to the presence of disease in our community, which of course we all just did for COVID-19. So that's a little bit of a depressing take on it for sure. But there are a couple of other things that I think are really important to note here. One of the challenges of this issue of vaccine acceptance, vaccine hesitancy, vaccine refusal is that actually in any given population, there are people who are under-vaccinated or unvaccinated because they don't want to, and for some of the reasons we've talked about, but there are also people who can't access vaccinations, or who may not have had their questions answered appropriately, or who may not have been activated yet to engage with services, and maybe those services are not reaching out to people as well as they could. But this idea of vaccine hesitancy, which the World Health Organization declared as one of the top 10 threats to human health in 2019, has been such a sexy topic. And what it has resulted in is often people and governments blaming individuals for their non-vaccination or conflating someone's unvaccinated status with them being an anti-vaxxer. And as a social scientist, it's actually been a really important thing for me to be part of a project of understanding in any population, well, what is the breakdown of people who are not vaccinated for access or acceptance reasons? And how do we think about interventions that tackle those? But, and crucially as well, in studying the way governments understand the vaccine policy problem that often results in them introducing a mandate, I've been astounded at how few of them actually acknowledge or know about or understand the under-vaccinated due to access people. They're very quick to understand and blame and kind of be cross with the vaccine refusers, but they don't always want to acknowledge that their own systems might be inadequate. So I've seen it as really an important part of my mission to speak truth to power, again, following on from what Jeff said, to actually be saying, well, we need to understand what governments think and know, and we need to call them out. If they're imposing mandates on populations when actually they have not facilitated access for those populations, then that's a very bad thing. And that happened in this country, building on Loretta's talk. We had mandates come in very early for COVID-19 vaccines for our aged care workforce. Now, was that a bad thing objectively? No. We need to protect our old people from COVID-19. But at the time those mandates came in, we didn't have good vaccine information and communication packages for people in different languages. And we know that that workforce is a migrant workforce, is a vulnerable workforce, a low-income workforce. So we were mandating these people very, very early to be vaccinated without wrapping around them the information and support that they needed. So that's the kind of thing that I believe is really important to know, to understand, and then to call out. So I think how am I going for time? 2 minutes. I think I can probably wrap up there. One final point is, again, to build off what Jeff said, it's really, really important for mandates and for me as a scholar of mandates to understand not just what the outcome of these policies is in getting vaccination rates up. I mean, that's obviously as a policy intervention, that's why governments are doing it. They're wanting more people to vaccinate their kids. They're wanting more of us to take our COVID vaccines. But crucially, we actually also need to understand whether populations accept those policies. We need to understand how policymakers articulate the value proposition of mandates. Think about it here in Western Australia. I would argue that we had COVID-19 vaccine mandates not ostensibly to actually protect us from the disease as our first priority, but so that we could open our borders. And that's a very different proposition for the public, for all of us, to think about, well, I'd better get vaccinated, the government will make me get vaccinated so that we can reopen. And I know that protecting public health is the next step from that, but that's a very different circumstance, for example, from Victoria, where a mandate was a way of getting people vaccinated so they could leave their locked-in homes and go back and join the economy, the workforce, social life. So understanding the way the discourses around mandates, the value proposition for them, the ethical conflicts involved in them, is a crucial part of understanding whether and when and in what contexts publics will accept them. And as a political scientist in particular, that's where I think comparative work is also really, really important. We have to understand any policy intervention in a context, and we can compare the success or failure of those interventions in different contexts once we understand what it is about those different settings that inform whether that policy is going to be a success or failure for the public, never mind whether it's a success or failure in terms of actually bringing about an increase in immunisation rates.